right, so our patient today is a 45-year-old female who's presenting to PT with complaints of bilateral neck pain and headaches following a motor vehicle accident. She's limited in cervical rotation bilaterally as well as cervical extension due to pain. So she also notes pain with prolonged sitting and a heavy head feeling, and she only gets relief when she supports her head in her hands like this.
She does have decent shoulder strength. It's 4 out of 5. We did notice walking in that she had forward head position and rounded shoulders. And her goal is to get back to her Zumba workouts and spin classes. So we're gonna treat the patient. We're gonna rotate. Devin's gonna treat the patient of me, and then I'm gonna treat him. But it is like if it was one patient.
So since our patient is having difficulty with that cervical rotation due to pain, we're gonna start with just a cervical rotation snag. So we're gonna have our patient just fold their pillowcase right in half like this. We're gonna go around the back so that the crease is just on the base of their skull like that. And so we're gonna just hold our left hand here. We're gonna just apply some tension and hold it down. And without trying to move our head, we're gonna let the pillowcase do all the work. And we're just gonna pull to the side, pull forwards rather, and let the pillowcase kind of rotate our head. That, and then we're going to switch sides. We're going to do it on the other side. And so we're going to have the patient do this about 12 to 15 reps, and we'll do 3 to 4 sets bilaterally. So what this is going to do is this is going to allow that patient to regain some of that cervical rotation motion with a little bit of assistance, and not having to do so much work with their cervical rotators.
Okay, for the second exercise we're gonna do in this beginning stage, we're gonna have the patient do a chin tuck. This is gonna help them, since they're having issues with their upper cervical flexion and lower extension. So basically what we're gonna do, this is just gonna help you get some motion back in those deep muscles in your neck. So what I want you to do is just look straight ahead, and you're gonna put your hand right under your chin there. And basically you're just gonna try to slide your chin straight backwards along your hand like it's sliding on a shelf. Perfect. And then come back. So if you feel like you're lifting off of your hand or digging down into your hand, that's incorrect. You should just feel like you're sliding straight back like you're sliding on a shelf. Good. And then hold it for a second and return to normal. Perfect. So this is something that the patient could do for about 15 to 20 reps, 3 sets of this. And like I said, this is going to help strengthen those upper cervical flexors and the lower cervical extension.
All right, so in this intermediate phase, we're going to be doing some I's, Y's, and T's on the Bosu ball here. So we're going to keep them separate just to keep track of the reps a little bit better. So the patient is going to be up on their toes on the Bosu ball like this. And we'll just start with I's. We got some small 2-pound weights here, and we're just gonna come straight up like this. We're gonna do our I's like that. And once we complete those, we're gonna come out and do a scaption motion like that to do our Y's, and then we'll come straight out to do our T's. So let's have you do these here. Weights. So let's have you do the Y's, or sorry, the I's. Sorry, we'll do the I's first. Good. Just making sure we're getting nice, good squeeze up in here, up in the upper thoracic, and then we'll go into our Y's. Yeah, good there. 2, and then we'll go into our T's after that. Straight out. Good. So what we're doing here is, this is causing us to, first of all, it's giving us core stability here because we're having to balance on the ball here. And then at the same time, we're getting cervical extension, and we're also getting thoracic extension as he comes up into those motions. And then in addition, we're getting a little bit of lumbar extension as well. So that's gonna help our patient with their upright stability as well as kind of getting the shoulders back and getting that extension motion back a little bit and regaining some of that cervical and scapulothoracic extension range of motion as well as strength. And with that, we would have the patient do about 3 sets of 15 reps in each direction. So in the I's, the Y's, and the T's as well.
Okay, so for the second exercise that we're going to do in this intermediate stage, we're going to have the patient progress off of what we did in the first stage with the chin tuck, although this time we're going to put a small ball behind their head up against the wall, and we're just going to have them do a chin tuck pushing their head into the ball while getting that upper cervical flexion and lower cervical extension. And then we're also going to have them do some shoulder presses as they're doing that. So I'll quickly demonstrate to the patient. Diana, basically what you're going to do, you're just going to put this ball right behind your head, and just like we practiced earlier with that chin tuck, so you're just going to do the same thing to start off. Put your hand under there just to get the motion, and you should feel the back of your head push back into the ball, okay? So you're just going to do that to start off, and then once you feel comfortable with that, I'm going to hand you a couple small little weights, and you're just going to do that, push your head back into the ball, and we're just going to have you press straight overhead with those weights, okay? Try to keep that chin tuck the whole time, pushing that ball into the wall. So go ahead. Good, so go ahead and do it a few times, just like we did before, sliding your chin along that shelf. Perfect, and you feel the pressure against the ball increasing?
Yeah.
Okay, good. So yeah, one more time, and then I'm gonna hand you these weights. So go ahead and just do that, and as you're doing that, you're just gonna also press overhead, just get some extra motion in there. Perfect. This whole time, we want to remind the patient just to keep sliding that chin straight back like they were on a shelf. Perfect, you can relax. Okay, so this is also something we could do for like 4 sets of 15 reps. And if this becomes too easy for the patient with the 2-pound dumbbells that we have here, we can always increase the weight. If they wanted to do this at home, they could use a soccer ball or any kind of ball they have.
All right, so going into the last stage here, we're gonna do some bird dogs. So I'm gonna demonstrate first here. So we're gonna be on our hands and knees here. And what we're gonna do is, at the same time, you're gonna bring your opposite leg and your opposite arm up. We're gonna hold there for about 3 seconds. Come back down. And we're gonna do the other side. 2, 3. Come back down. So let's have you come down here and try those here. So quadricep, let's keep our head up, kind of looking forward here. So let's take your right arm and your left leg, start there. Come up, hold there, 1, 2, 3. Come back down. Other side, left arm, right leg. 1, 2, 3, good. So what we're doing here is kind of a progression from the I's, Y's, and T's that we did on the Bosu ball. We're doing this, we're getting cervical extension here, having the patient keep their head up. We're also getting thoracic extension, lumbar, and hip extension. So it's kind of like a full body extensor workout here. And then we're getting some endurance there and some stability as well by having the patient kind of hold that position for a few seconds. How's that feeling? Good. All right, you can relax. So we would have the patient do this for 20 reps on each side, and we do that for 3 sets, and that's going to help kind of just regain all that extensor strength from cervical all the way down into lumbar and the hip as well.
Okay, so for this last exercise in the final phase, we're going to have her try to get a little bit of more dynamic movements as she wants to get back to her Zumba and spin classes. So what we're going to do is a 4-way cervical resistance with a resistance band. So basically I'm just going to put the band around her head in different directions, and she's gonna move in different directions. So I'll be off to one side and she'll move away from me. I'll go on the other side, she'll move in the opposite direction, and same thing forward and backwards. So this is just gonna have her resist the resistance band that's trying to pull her into whatever movements that is, whether it's flexion, extension, or lateral rotation. And this is just gonna get her up on her feet, moving again, like I said, in a more dynamic way so she can get back to Zumba. So we have this band. We're gonna wrap a pillowcase around it just so the band doesn't get tangled on her hair or anything, or just add a little bit of extra cushion also. So what I want you to do is I just want you to put this across the front of your forehead, and I'm gonna wrap this behind you. Perfect. Now what I want you to do is I'm gonna pull some resistance backwards, and I want you to fight that as you take a step or two forward, okay? So go ahead and give that a try. Take a step forward, perfect, and come back. Stand it there, do it again. Perfect, and come back. And now we'll go over to the side so you can see how it feels to the side. Okay, once you get ready, take a step to the left. Perfect, and come back. And one more time to the left. Good, and come back. So that was having her go forward and to the side. As I said, we do this in all four directions, so I would be behind her, in front of her, and have her go backwards, and then I'd also be on the other side, having her go to the right. This is going to, as I said, have her build up some endurance and more dynamic stability in that neck and strength. And we could do this 15 times in each direction. So we have her do it 15 times forward, take a little break, have her go backwards and side to side. So after this, she should be able to get back to that Zumba that she wants to do.